Hello, my name is Quiana Jenkins, and today we're going to talk about preeclampsia and postpartum preeclampsia. We'll start by talking about the diagnosis. Preeclampsia is a form of pregnancy complication where the patient experiences high blood pressure and proteinuria. Eclampsia is a severe case of preeclampsia that results in seizures due to the high blood pressure during pregnancy. The main difference between these two conditions is that eclampsia can lead to seizure and even coma. The diagnosis of preeclampsia happens if the patient has a high blood pressure after 20 weeks of pregnancy, proteinuria, and a lower blood platelet count. The nursing diagnosis of eclampsia requires a systolic blood pressure of above 140 and a diastolic blood pressure of about 90. The pathology of preeclampsia and eclampsia is not quite well understood. The factors associated with these two disorders include the decrease of utero-placental blood flow, which develops as a result of poorly aligned uterine placental spiral arterioles. The condition is normally an abnormality that is genetic on chromosome 13. Eclampsia is specifically an immunologic abnormality that results from infarction and placenta ischemia. The clinical manifestations of preeclampsia include proteinuria and blood pressure, whether or not they are an existing systemic abnormality pertaining to the kidneys, liver, or blood. Other complications associated with preeclampsia include fetal growth restriction, which is mainly caused by the reduced amniotic fluid and abnormal fetal oxygenation. The clinical manifestation of eclampsia include diarrhea, nausea, and vomiting, including reduced blood pressure and an irregular heartbeat. To diagnose preeclampsia, the healthcare practitioner measures the blood pressure of the patient and tests the urine for protein during the prenatal visit. The health of the child is checked used during ultrasound. The laboratory tests which rule out preeclampsia include hemoglobin, platelet count, and creatinine. A biophysical profile or a non-stress test is also performed on the patient. Treatment and medication management. Preeclampsia, eclampsia are treated using antihypertensive drugs which lower blood pressure. Eclampsia is treated using anticonvulsant medications, magnesium sulfate, which prevent seizures. The unborn child is protected through delivery by giving the patient corticosteroids, which promote the development of the baby's lungs. Patient education and follow-up. Patients with preeclampsia or eclampsia are required to follow up after hospital discharge to ensure their blood pressure is constant and normalized, and also record any laboratory abnormalities. This medical follow-up is undertaken through the obstetric internist and obstetrician. Postpartum signs of preeclampsia are also checked, which include severe belly pain, headaches, and nausea. Thank you, and please see the references below.